Dear colleagues, for any intraocular surgery, the eyelid margin must be nicely covered with plastic strips so that instruments that go into the eye doesn't come in contact with the eyelid margins. This is a phacoemulsification procedure of soft white cataract. The ocular surface is thoroughly irrigated, first applying betadine 5% lotion, and then a thorough wash is given with ringer lactate or balanced salt solution. Now this is the main incision, 2.8 millimeter. This is placed at a selected site. Now in this case I'm going to use trypan blue dye, so I'm going to make one side port incision on the right side of the main incision and then inject this air bubble into the anterior chamber. The anterior capsule can be stained without injecting air bubble also, but I prefer to inject the dye underneath this air bubble. Now the dye is washed out immediately. There is no need to wait for 10-15 seconds. Just inject and immediately after 4-5 seconds wash it out. Enough staining occurs within this very short period of time. Now viscoelastic substance is injected into the antechamber. The antechamber is filled up. I use HPMC, hydroxypropyl methyl cellulose, and this is another side port on the left side of the main incision. Now anterior capsule is incised with a 26 gauge disposable bent cystodome, and we can see some oily fluid comes out. In this case the intumescence is not much. In some cases the intumescence is really too much. In this case we probably could do capsulorhexis in on go without making this minirhexis, but since there is some convexity in the anterior surface of the cataract, it's safer to decompress to decrease the intralenticular pressure and then enlarge this rhexis. Now viscoelastic substance, again HPMC is injected. A small cut is made at around 8 o'clock with Vanna scissor. Rotator forceps is used to hold this capsular tag, and a continuous curvilinear capsulorhexis is made. This is not a circular rhexis, but this is a continuous, fairly acceptable capsulorhexis. Now this is a soft cataract, and I'm going to do direct chop in this case. It takes very short time when the cataract is of this softness. The phaco power in this case was only 40%. Flow rate was 42 ml per minute and vacuum was 400 millimeter of mercury. And now viscoelastic substance is again injected and cortical cleanup is done. In this case I have used a 23 gauge Simcoe cannula to clean the cortical matter. This instrument is very simple. I use a 10 cc glass syringe to create adequate vacuum. Now under irrigation, a hydrophilic acrylic intraocular lens is implanted in the capsular bag. The irrigating probe is used to guide the trailing haptic into the capsular bag. Since we have not used viscoelastic substance, the time required to wash out the viscoelastic substance is saved. Now this is moxifloxacin. The side ports are now hydrated to make these incisions waterproof. So that tear film cannot enter into the eye. Now this is the final wash with BSS. Thank you very much for watching. Dear colleagues, we must be very meticulous. We must respect cells, tissues, and be competent surgeons. Thank you very much for your attention.